At the community level, and that's where our campaign actually begins, at the community level, we planned on engaging local imams at the mosques, because people are not going to the mosque right now due to lockdowns, but the azan is still taking place. So that's a platform that reaches, the sound reaches every single household in that neighborhood. So we will be engaging imams and mobilizing them as providers of public service messaging from the mosque at regular intervals, 3 to 4 times a day. And secondly, for bringing the message closer to the home, for that, because transport is not working and local small transporters are all available in all communities, we have planned that we will be deploying branded vehicles with recorded audio messages that will be delivered through a PA system as it moves from one neighborhood to the next. That is already being undertaken by the government, and in order to sort of engage at the community level with those kinds of messages, it is important that we have public sector endorsement and public sector support for those messages. So we are interfacing with the government at the provincial level as well, to work collaboratively with them and use existing materials that they have and adapt it to our particular needs. Now, with regards to the messaging, we've developed a very structured approach where we've identified specific themes, target audiences, the durations, and the forms that those messages will take. Our communications lead has developed a detailed matrix of all the communication collaterals and which one will be deployed at what time, for what audience, and how will that message trickle down towards women. So we've also identified a series of behavioral objectives for our community respondents. For example, at the community level, we want the community opinion leaders to influence men to discuss health planning and family safeguarding with their wives and promote interspousal communication. At the household level, we are focusing on husbands and mothers-in-law with messages that responsible fathers and husbands talk to their wives about safeguarding their families, so promoting interspousal communication for health planning. And then at the individual level, we are looking at providing specific messages that link women to information and services, move them from the point where they're not really thinking about it to when they start thinking about it, then they start planning about it, and then at the provider level, we engage them so that they mobilize them from intention to actual adoption of a family planning method. But one important parameter in all of this that we've built in across all strategies is to ensure that we remain gender sensitive and we address gender norms.